Many offices have been empty since 2020 and are filling back up with employees in 2025. As people are returning to their normal office routines, they're spending more and more time during the day sitting in their chairs. Today, spine specialist Dr. Peaches is here to give us some tips on how to keep our backs strong, and he's going to share some exercises that you can do. Welcome to CI Living.
Thank you, Jacqueline, for the intro.
So can you tell me a little bit about yourself and about your practice?
Of course. So I am a NASS accredited or interventional spine and sports fellowship trained physician, specialized mostly in the spine and other sport injuries. And my take on everything has kind of changed a little bit away from conventional therapies and into the world of the disc seal procedure because it has helped change my life altogether.
And so what is the disc seal procedure?
So the disc seal procedure is a procedure that was created by Dr. Kevin Pauza, where we use fibrin, which is a natural molecule created in the body that creates, basically when you get a cut and you get that first layer of healing, the fibrin is kind of what brings everything together and allows the cascades of everything to come in and start the healing process. And what was developed or seen to do is if you basically go into the disc, and the disc has two parts. You have a center part in the middle, and then you have the outside part, or the annulus.
So this then is a disc.
No, so the disc would be the red part.
Okay, so the disc is the red.
Yeah, so it's in between the two vertebrae, and it has a center part, which is the nucleus pulposus, which is like a jelly-type structure, and then the outside is called the annulus fibrosus, and it basically imagine like a tire. Okay, or a balloon. And this outer part gets little tears in it as you go along with your life. You know, I don't know, you picked up your kid, you bent over. Some of them could be tiny along your life, or some of them could be really big, and it's called an annular tear, and that's something you go to your physician, and usually the first thing is physical therapy and then steroid injections and continuing on and on. But with the disc seal procedure, basically what we do is we come in with a little tiny needle in this direction, right above the nerve, into the annulus. And we inject dye into the annulus. And if it seeps out, and we see it seeping out of the disc, hey, we know it's a bad disc. So what we do is we inject the fibrin, which seals off that disc, and then allows the disc to start the healing process, because it actually gets its nutrients, depending on who in the spine world you talk to, some say it just dissipates, but what just dissipates, right? So there's always got to be something. So the ongoing theory is that it gets its nutrients from the bone above and below because the disc has no blood supply.
I see.
And by sealing the disc, you're preventing the inside of that jelly-like substance that comes out that's actually caustic to the environment around from coming out, as well as now getting that barrier so when you're walking and moving and you have that motion like this, the nutrients can go into the disc and let it heal, and then the toxins can come out of the disc.
I see.
Okay?
So that sounds way less invasive than having traditional back surgery.
Oh, 100%.
And then you had mentioned that it's not great, obviously, to sit all day. So how often should people get up and walk around if they're back to work and they're sitting at a desk 8 to 12 hours a day? Of
course, of course. So based on this, I kind of looked into it a little bit deeper, and there is a research study that was done. It's a MSC responsible to pH levels in the actual cell. It was done out of the University of Vermont. And the study basically goes into different pH levels and how the mesenchymal stem cells react to the pH levels in the disc. Now, the disc produces basically acid stuff through its process, since there's no blood supply, is mostly glycolysis and stuff. So it's going to produce lactic acid, and that lactic acid is going to build up, and the higher the acidic content is in the actual disc, the less it could regenerate itself or continue being a viable disc. So let's say you already have an injury and now you're sitting at your desk for 2, 3, 5 hours. You're just creating an environment for that disc to never want to heal.
Gotcha.
And that's where, these positions, we have these desk jobs, and we take a look at somebody's MRI in their 50s or 60s after having a 30-year clerical job, and hey, why is your back so bad? Right. Well, hey, you never gave it a chance to heal on its own. So
you want to try and get up maybe every half hour, every hour, walk
That
around?
would be amazing, right? But let's say real job scenario, right? Your boss doesn't want you up all the time. You're not being productive, whatever. So I kind of base this off of something else a little bit too. Where is your window of concentration? If you look at people who study or do any kind of longer duration of things, 45 minutes on, 15 minutes off is a pretty good thing, right?
Yeah.
So during your 15-minute break, make sure you're walking for a continual 5 minutes during that.
Excellent.
Because the study showed that 5-minute thing could actually increase your pH by enough points to put it back into the, hey, we're a healthy disc level.
Okay, and as we wrap up, did you have a stretch you wanted to show us to help with your spine?
Yeah, of course. So one of the best things, and we will be coming out on our website with a new Spike workout that's going to integrate the back health and everything. But the best thing I think right now you can do is kind of, you stand up at your desk, you go in like a wide squat stance, right? Almost like a sumo squat.
Okay.
And if you need to, you could place your hands on the desk itself.
Okay.
If not, you could always go put your hands like this and then just squeeze everything together and tuck your pelvis in. So tuck it in, squeeze your arms, squeeze your hands, and squeeze your whole body together in like a slight squat, and make sure your hamstrings, your quads, and your glutes are activated. And what this is gonna do is this is gonna activate and turn everything on so your muscle firing patterns are good. And do this for 90 to maybe 120 seconds, and then go on your 5-minute walk.
Great. Well, thank you so much for being here, and thank you for that exercise and all the information you shared today.
Of course.
If you want more information, you can visit us on the web at ciliving.tv, and we would be happy to connect you with Dr. Peaches.